For females, we tend to separate the causes into categories or boxes, and we like to use, you can use anatomical parts, so different parts of the body and which parts may be having a problem and leading to infertility. So if we do, ovaries, pelvis, and tubes, and uterus as sort of the three parts, in the ovarian category, you can have problems with ovulation, so you don't release an egg every month. Different reasons for that, like polycystic ovaries, or you can have problems with other hormones, with prolactin, thyroid, all of these things that can affect the menstrual cycle. So if you're not releasing an egg every month, that lowers your chances, obviously, of conceiving, of getting pregnant. There can be, cysts or endometriosis or conditions that can damage the ovaries or the eggs or their quality. And then as I would say, one of the most common ones that we see is just age. So just aging. As we age, we have less and less eggs left because we're born with a fixed number and we ovulate them throughout our life. So at the end, we just have less with time, but also the quality. So the ones that are there at the end are usually less good quality. So all these causes relating to the ovaries. If we look at the tubes and the sort of the pelvis in general, things that can block your tube or damage your tube, such as infections, in the past was sexually transmitted infections. Endometriosis can block tubes or damage them or fill them with scar tissue, fluid. All of that reduces the chance that egg and sperm can meet in those tubes. If we think about the pelvis more as a wider sense, also endometriosis and scarring can be outside of the tubes, but also affect fertilization with scar tissue, inflammation, etc. And then if we think about specifically the uterus, so the implantation, the pregnancy staying in the uterus, so things like fibroids that are muscle tumors, they're usually benign, but they can deform or distort the cavity and prevent the embryo from implanting or cause more miscarriage because there's less good areas for the embryo to implant. And then something called adenomyosis. So again, it's the tissue that is supposed to be inside the uterus is contained in the muscle instead of just being inside where implantation happens. So if you go sort of by anatomical part or categories, you can see all the different places that things can go wrong and infertility can occur. And then sometimes it's unexplained, which can be very frustrating for couples, but sometimes it just means that we don't know the cause with our tests, but there is a reason that we can pinpoint, but we can still offer treatments. So that's another category. My pleasure.
Thank you very much. It was very informative.